Did you know that there are some women that test positive to pregnancy? They have all the symptoms. They test positive, like that's with use of the pregnancy test strips. They test positive. They are over the moon, excited. They've been waiting for this baby for a very long time. And then at their first scan, 8 to 14 weeks after, they discover that there is no baby. This condition is called molar pregnancy. Hello beautiful people, welcome back to my YouTube channel. On this channel we talk about health related issues, but we are a little biased. We do more of sexual and reproductive health because it's typically expected, because I am an advocate. So on this channel we talk about everything health related issues. We try to balance it out. Back to our topic for today. Molar pregnancy is a rare condition where a non-viable egg implants in the uterus and then causes a lot of complications. There's actually no baby, but you're presenting with all pregnancy symptoms, even a growing uterus. So we're about to talk about this medical condition. Please stick with me. Let's dive right in. So there are two different types of molar pregnancy. The first being the complete mole. So in the complete mole, the fertilized egg has no fetal tissue, and then it has some abnormal placenta tissue. It's typically cyst-like. So the second type is the partial mole. The partial mole is rare, unlike the complete mole. The complete mole is actually common. So the partial mole is rare, and the fertilized egg here has some abnormal placenta tissue. It also has some fetal tissue. So there are things that can cause a molar pregnancy. We can refer to this as risk factors, things that put you at higher risk of having a molar pregnancy. The first of such is genetic error. Now, if there is any abnormality in the chromosomes of the fertilized egg, you can get a molar pregnancy. Second of such is age. Women over 35 are at higher risk. And the last but not the least is if you have previous history of molar pregnancy, you're at risk of having another molar pregnancy. So I like to say that symptoms of molar pregnancy are not typically telltale like signs that you just see. It may be indicator for other conditions or other complications. But I like to say this: if you notice any of these complications, there's no need trying to identify if it's a molar pregnancy or not. You should get to the hospital as soon as possible. So you may notice severe nausea and vomiting. That's the first symptom. You may also notice uterine bleeding or spotting. You may notice pelvic pressure or pain, and also rapid uterine growth. If you notice any of the symptoms, go to the hospital. There are complications that can arise from having a molar pregnancy. The first of such is a gestational trophoblastic disease. This is a rare form of cancer that can develop from a molar pregnancy. You can go into preterm labor. You can also have placenta problems, and worse still, the emotional distress that comes with it. It's very devastating. For diagnosis, typically an ultrasound is done to ascertain presence of a molar pregnancy. This is followed up by dilation and curettage, popularly known as a D&C, to remove the abnormal tissue. Follow-up is also done so there is no case of complications like GTD I mentioned. That's the gestational trophoblastic disease, the cancer I talked about, and emotional support like counseling and all other type of emotional support to cushion effects of this loss. So I'm sending love and light to anyone that has been in this situation. And if you've noticed any of the symptoms I mentioned in this video, please do well to see your physician for tailored diagnosis. Thank you so much for staying to the end of this video. I'll see you in my next one. Bye.